This is a step-by-step guide and instructions for use for the lightning needle. The following instructions are not meant to define or suggest a medical or surgical technique. The clinician is responsible for the proper procedure, site, and technique used with this device. While the lightning needle is available as a sterile single, it also comes prepackaged in the Marrow 45 kit. The lightning needle comes in various lengths to allow for bone marrow aspiration throughout the anatomy. The lightning needle is a single-use disposable device that contains 8 large, smooth, bevel-edged fenestrations allowing for gentle bone marrow aspiration. The lightning needle's unique design incorporates a plunger component that, when inserted down the cannula, creates a void or frac where bone marrow pools. Unlike most traditional bone marrow aspiration devices, the lightning needle can be inserted with any sterile drill using our universal single-use sterile adapter. The following figures detail how the universal driver adapter is inserted into a drill and how the cannula assembly is then attached to the driver adapter. The lightning needle is approved for bone marrow aspiration from many sites throughout the body. The following is a step-by-step bone marrow aspiration technique guide for aspirating bone marrow from the proximal tibia using the lightning needle. Instruct facility staff on the following steps. Prepare the aspiration supplies according to the Marrow process guide. Palpate and locate the proximal tibia tubercle. The proximal tibia tubercle is also known as the tibial tuberosity. Select an optimal entry point approximately 2 finger breadths distal and 1 inch medial to the proximal tibia tubercle. You can see here that the optimal entry point is located on the medial aspect of the proximal tibia. Using aseptic technique, prep the skin. If desired, apply local anesthetic to the prepped area. Palpate the site to reconfirm the optimal entry point. Use the Z-track method to retract the skin at the optimal entry point. Make a stab incision with a number 11 or number 15 blade sterile scalpel. Remove the lightning needle set and driver adapter from their sterile packaging. Properly secure the driver adapter to the drill with the magnet tip exposed. To accomplish this, insert the hexagonal end opposite the magnet, of the driver adapter into the chuck of the drill. Ensure that the driver adapter is engaged into the drill as much as possible until a round portion of the driver adapter makes contact with the front end of the drill chuck jaws. Tighten the jaws of the drill chuck around the driver adapter. Ensure the driver adapter is properly captured in the drill chuck. Attempt to pull the driver adapter away from the drill chuck. If the driver adapter moves when pulled upon, re-tighten the drill chuck until no movement of the driver adapter is felt. Securely attach the cannula assembly with its protective cap to the driver. Be careful to maintain strict sterile technique. Control the patient's movement prior to and during the cannula assembly insertion. Ensure that at least 5 millimeters of the cannula is visible. Carefully remove the protective cap and position the cannula assembly over the entry point at a 90-degree angle to the bone. Activate the driver by squeezing the trigger. Insert the cannula assembly into the bone with gentle, steady, downward pressure. Advance the cannula assembly and penetrate the cortical wall. A slight release of pressure will be felt. The cannula is seated when the base abuts the skin. Release the driver's trigger and stop the insertion process. Remove the drill and driver adapter from the cannula assembly by pulling outward. Slight downward pressure on the cannula assembly will assure its stability. To assure the lightning cannula assembly remains properly seated, apply gentle downward finger pressure on the trocar hub while removing the drill. Remove the trocar from the cannula assembly by turning the trocar counterclockwise 1 1/2 turns and then pull back. Confirm the cannula stability. Insert the plunger into the cannula and seat it fully, then gently remove the plunger. Attach a syringe to the luer lock hub on the cannula. Begin marrow aspiration by gently pulling on the syringe plunger. Slight downward pressure on the needle will assure the cannula stability. Do not pull back on the syringe body, as this may destabilize the cannula. If additional marrow is required, attach and fill a second syringe or repeat steps 9 through 12. If performing a second drilling procedure, the cannula assembly may be placed approximately 1 centimeter adjacent to the first entry point. Remove the cannula from the patient by attaching a luer lock syringe and continuously rotate clockwise while slowly and gently applying outward traction to the cannula. Do not rock or bend the cannula during removal. Once removed, discard the lightning needle set in an appropriate sharps container. Dress the aspiration site as appropriate.